St. Lucia and 5 other OCS member states have completed the first step in their quest to secure funding for programs targeting nationals living with HIV/AIDS, sexually transmitted infections, and tuberculosis. The Regional Coordinating Mechanism, the RCM, in the last year and a half guided the Ministers of Health as well as national commissions and NGOs in developing a concept note or proposal for the Global Fund for a $5.3 million grant. Joan Didier is the coordinator of the RCM.
We have gone through an inclusive process and we have developed a concept note, but before we can submit it to the Global Fund, all the members of the Regional Coordinating Mechanism have to endorse this. So for the last 2 days we have been going through the proposal, and now we have gotten the endorsement of the members. So this is a first step. The members have endorsed, along with our chair, Health Minister Reynolds. We also had with us the Minister of Health of the Commonwealth of Dominica and the Minister of Health of St. Vincent and the Grenadines. They have also endorsed. The other 3 ministers will now have to endorse. Then the concept note has to go to country for the country coordinating mechanism or the National AIDS Commission, whatever they call it, to endorse. And once that happens, we will submit the concept note to the Global Fund.
The OCS Commission will be the principal recipient for the implementation of the grant.
The funding in this proposal seeks to address the access to care by vulnerable populations. And in our context, some of the most vulnerable populations have been identified as men having sex with men, sex workers, and youth. I just also want to say that any proposal that goes to the Global Fund has to be evidence-based. So we cannot just say to the Global Fund that we have 10 young men. We have to provide them with the data to support that. So that has been a long process because one of the gaps in the OCS is the lack of strategic information. And we are going to ensure that there is some component in this grant that is going to enable the OCS countries to be in a better position to document and therefore have the strategic information that we're lacking.
St. Lucia's Health Minister, who is the chair of the RCM, has commended the regional officers for completing the tedious process.
So today we've reached a milestone, another day in the lives of persons who are affected in the whole situation of prevention that we try to push through in the OECS region. So on behalf of the OECS Ministers for Health, and I really want to thank Minister Kenneth and Minister Burgeon for being here to sign on and endorsing this process. I will take responsibility for the other ministers. They will sign on because they have given commitment. Though they are not here in the physical, they're here in spirit, and they will sign on as quickly as possible to ensure that this concept note gets to the Global Fund with all pieces in place, and that will be able to implement within the time frame.
Health Minister Alvina Reynolds there.